You will love to listen what he's going to say about cosmetic gynecology and how a woman can approach and seek the problem to be solved. Talking about a gynecology clinic, 20% or 25% of the practice is about white discharge. And hysterectomy is the only solution. There are many people who do hysterectomy for white discharge.
If you leave apart the fungal infections which are actually happening in vagina, most of the discharges in the vagina, they originate from cervix. That is hysterectomy the treatment? Absolutely not. The patients who have got a cervical erosion, they are more liable to be infected with HIV. No woman should die of cancer of cervix. Think of a woman who has to keep pads for a discharge or who always feels that there's something leaking down there and she's wet. Na rahega baans, na bajegi bansuri. If there is no uterus left, where will the discharge come from? Which is absolutely a barbaric way, I think.
Why do they actually have urinary leakage after delivery and during postpartum period?
It is proven that pregnancy and childbirth are the biggest risk factors for causing incontinence.
A lot of women do experience either laxity or difficulty during intercourse or dryness in the vagina, but they think it's normal. They must share in the groups of friends but don't know that they can seek help. What options of treatment have you got available for them?
Just for this lifestyle issue. In the current medical practice, we have got excellent options today to manage these problems with a non-surgical way. I would say that if we can avoid heat in vagina, that is the best option. With non-heat based treatments, using reversible electroporation, it treats vaginal laxity as well as urinary incontinence without any harmful effect.
All those women who are silently suffering, what is one message you would like to give?
Chuppi todo, stritva se nata jodo. Break your silence and connect back with your femininity.
Welcome to today's conversation. That which many women need but rarely seek. I'm talking about problems which most women in different age groups face, which could be vaginal discharge, which keeps coming back, post-delivery, either vaginal laxity, discomfort in intimacy, or urinary leakage, and around the perimenopausal age group where there will be intimacy difficulty, laxity, and whatnot. The truth is, because something is common, it need not be normal. And because you think it is normal, it doesn't mean that you should not seek assistance and medical help. The point is, you should know that there is help available and you can seek it. Today, we are diving into the world of cosmetic gynecology, not with exactly a cosmetic lens, but thinking of confidence, comfort, and quality of life. And why is this important? Because every woman deserves to feel strong, comfortable, and happy with how her life is. I'm joined by a specialist in this field today who has pioneered cosmetic gynecology. If I say, from India, Sushrita gave Ayurveda to the world, Dr. Navneet Magon has given cosmetic gynecology to the world, a pioneer in the field. He's a dean of Indian College of Cosmetic Gynaecology, a founder and regularly organizes RecoGyn annually with international faculty. He's one among the first to introduce and shape cosmetic gynecology in India and spread around the world. He's also a founder of El Sante Group of Clinics. An entrepreneur, a trainer, a mentor, a true visionary. You will love to listen what he's going to say about cosmetic gynecology and how a woman can approach and seek the problem to be solved. Coming to treatment about women, I thought I'll divide them into three groups. One, everybody. One, people around pregnancy and post-delivery. And the third group is around menopause. Let's cover every woman. Like talking about a gynecology clinic, 20% or 25% of the practice is about white discharge. Why is it important to identify the reason and fix this? And there's so much about vaccination as well. Can you answer my two questions? Why is it important to treat the white discharge? And hysterectomy is the only solution because there are many people who do hysterectomy for white discharge.
You have hit the nail right on the head straight off. So I think, again, since I'm talking to you and you're a gynecologist yourself, you would appreciate and agree with my point that if you leave apart the fungal infections which are actually happening in vagina, most of the discharges in the vagina, they originate from cervix. But since they come from vagina, it is commonly called as a vaginal discharge, but it is the cervix which is cause of this discharge. And we all know that, statistics have told that between 20 to 50% of women have something which is called cervical ectopy or cervical erosion and other cervical infections. Now, these are what cause the discharge most of the times. And as you very rightly said, that almost 30% of gynecological OPDs are because of these so-called white discharges, which may not be very white at times. So it is important to pinpoint what is the cause of that. And as I always have been saying, right from my days of teaching at FMC and beyond, that you cannot treat the cervix by seeing the face. So a per speculum examination is extremely important and integral part of any gynecological examination. And once you put a speculum, specifically a cuscous speculum into the vagina, it can most of the times give you the telltale story of this discharge which is coming from the vagina. So this is one thing which is treatable and can be treated. Now coming on to your point, that is hysterectomy the treatment? Absolutely not. Hysterectomy is not the treatment. Unfortunately, even now it is under the scanner of the government and regulatory authorities that there are a lot of unnecessary and unrequired hysterectomies have been happening in our country. And at times, the mindset has been, and specifically of, some people who probably do not think very carefully about the woman's life and her sexuality, that if a woman has finished childbearing, she does not need the uterus. It has become like an vestigial organ. And even if she has got, erosion or a discharge coming on, hysterectomy is the way forward. Hysterectomy is absolutely unwarranted and unrequired. To be very honest, these days the medicine has progressed so much that hysterectomy is required only in very limited cases. If it is a full-fledged cancer involving either the cervix or the uterus, or probably if it is a big fibroid which is causing pressure symptoms and myomectomy is not possible or is not the solution or is not required. I don't think today, hysterectomy is required for any other thing. Even for prolapse, you should actually not be doing a hysterectomy because you are taking away the central support of the pelvis and predisposing the female to multiple problems which will come post hysterectomy. So hysterectomy is, I would say, just required. Where you cannot avoid hysterectomy is only these two conditions which I mentioned. It doesn't come to my mind in modern medicine that a woman requires hysterectomy for any other condition very often. Now, that said, if we start treating these problems of discharges and the cervical diseases, specifically the cervical erosion and ectopy, which are definitely responsible to predispose the female to infections like chlamydia, which causes a lot of discharge at times, infections like transmission of HIV from a HIV positive partner, because it is well established and evidence has proven that if a woman has got a cervical ectopy, and if I have the liberty of calling it cervical erosion because many people would be able to better correlate with that, although cervical erosion was the old name for the cervical ectropion. But the patients who have got a cervical erosion, they are more liable to be infected with HIV with a HIV positive partner. Now, some people may argue that if a woman gets to know that her partner is having HIV, they would either use a barrier contraception or they may not be having, sexual intercourse with the HIV positive partner. But you tell me, is it possible for every woman to know that if her partner is HIV positive or not? It's mission impossible because screening is not done just like that for men if they're walking on the road. Women still undergo a screening for HIV when they become pregnant because there is an opportunity to screen them at that point of time. But for men, unless and until there are symptoms, or if their wives have been found to have HIV during their pregnancy screenings, or they have undergone some surgery and at that point of time the virus markers were done, so men are not even found to be having HIV and they can be carriers of HIV for a long time before they become symptomatic and they are found. So the women are at risk of getting infected with HIV from their partners who are not yet, I would say their HIV status is not yet disclosed. And if this woman has got cervical erosion or ectopy, there are much higher chances of she getting infected with HIV. Now, coming on to one of the most popular things, because you mentioned the vaccine, the HPV, the human papilloma virus, which is said to be responsible for majority of the cases of the cancer of cervix, something on which the whole world is trying to focus on, because they say that it is one of the preventable cancers and it is one of the treatable cancers if found in early stages. So, no women should die of cancer of cervix. There has been a lot of focus on that. There has been a lot of focus on vaccine. Definitely, if the vaccine is good, it will one day prove its potential and the screening for cancer of cervix will stop that day. But since the current guidelines do recommend normal screening protocols, as if a woman has not been vaccinated, so we cannot say that vaccine has proven its potential. So we need ways and means to prevent a woman from catching the HPV infections. Again, if a woman has got a cervical erosion or ectopy, we know, and it is proven by science, that they can be easily infected by HPV, because the human papilloma virus needs to get into the basal layers of cells, and the columnar layers which are there during the cervical erosion are much thinner than the normal squamous epithelium which is supposed to be on the ectocervix. So it is again very important that we should not leave a woman with cervical erosion, and we must treat it. And treatment of these diseases will prevent the women from contracting HIV infection from their partners, preventing HPV infections, preventing chlamydial infections, and never forget, save them from the very troublesome symptoms of vaginal discharge and itching, which can actually be too bothersome and embarrassing for women. Think of a woman who has to keep pads for a discharge, or who always feels that there's something leaking down there and she's wet, or she just has to keep itching in public places, which becomes very, very embarrassing for these patients. And we know very well that these patients have been visiting the gynecological clinics. They have been given pessaries, they have been given probiotics, they have been given whatnot, antibiotics, but most of the times there is no cure for this. And that is why so many hysterectomies are being offered to these patients, as that okay, na rahega bans na bajegi bansuri. If there is no uterus left, where will the discharge come from? Which is absolutely a barbaric way, I think, in modern day medicine. Hysterectomies have to become obsolete unless and until she has a cancer which requires a hysterectomy, in my humble opinion.
Absolutely amazing, sir. So to summarize, you're saying vaccinate to prevent all the future problems, do not do hysterectomy. But there will be a group of women who will be coming with recurrent vaginal discharge, who have taken tablets and nothing worked, it keeps coming back. Can you suggest us what are the latest mode of treatments which can be offered to these women?
Yes, that is something which is very close to my heart, and something which we have termed as cervical rejuvenation. Now, like the terms vaginal rejuvenation, ovarian rejuvenation, to make it interesting for doctors and patients to understand, I have given it a label, cervical rejuvenation. With the new electroporation treatments with which we have been treating the vaginal problems of laxity as well as incontinence, we have now started treating these patients and treating the cervical erosion using the reversible electroporation with the jet plasma therapies. Now, with the cervical probes of jet plasma technology, you can treat these cervical erosions. We have been doing it in our centers, like we have a more than 90% success rate. We have complete evidence of these treatments. We have proven that you can treat the cervical erosions and patients become asymptomatic very soon with just 3 treatments. Now, before this, just to mention, people had no options. The only way was to ablate, either using a cryocauterization or a thermal ablation. So ablation in layman terms would mean burning that area by extremes of heat, extremes of temperature, either very hot or very cold, and the cells are given a death sentence that okay, you have gone bad, we are giving you a death sentence, with a hope that the new cells, whenever they will come normal. It is a long procedure. It is not a treatment, we have to understand, and till that time patient has a lot of discharge, and we do not have an evidence that it is going to change the cell morphology or not, and it is going to prevent the patient from all what we just discussed about those infections or not. So the current treatment, I would say my preferred treatment is the reversible electroporation of the cervix, which treats cervical erosion, cervical ectopy, and many other cervical diseases.
So jet plasma therapy it is for cervical erosions to create and bring life and create new tissue. That's wonderful. And now moving on to the women who are pregnant and just delivered. Why do they actually have urinary leakage after delivery and during postpartum period?
We all understand that progesterone is the hormone of pregnancy, and progesterone prepares the complete pelvis for the delivery or the birth of the baby. Because you have to understand, from a vagina which is normally so narrow, a full human child passes out, a human infant passes out, and the diameters are, much big than the diameter of the vagina. So everything has to get lax. Progesterone, and in the current era, when a lot of patients actually are helped with assisted reproductive technologies, the amount of progesterone given to support the pregnancy has increased than only the natural progesterone which was given by the body. This leads to vaginal laxity. This also leads to relaxation, or I would say loosening of all the ligaments. Now, after that, when a patient has a vaginal childbirth, and if at all there is some kind of delayed progression or an obstructed labor at any juncture, so it damages the fetal head, and the fetal shoulders have a great potential to damage the pubourethral ligament and the pubocervical fascia. Now, the whole concept is that the women remains continent because there is a urinary bladder which fills the urine in it. Then there is a urethra, and there is a process of micturition. And when that process of micturition starts, only then the urine comes out, and at all other times the woman is continent. Now, if the intra-abdominal pressure increases at any point of time, either because of laughing, sneezing, or during intercourse, the continence mechanism acts in, and the pubourethral ligament and the pubocervical fascia help in keeping the urethra totally closed and compressed. And there are other mechanisms also, but since you talked about the childbirth, so I'm focusing on what gets damaged during pregnancy and childbirth. Now, when there is a vaginal delivery, so most of the times the ligaments are damaged, and the pubourethral ligament can totally get broken, or it becomes lax. So at any point of time when the intra-abdominal pressure increases and the pelvic girdle actually comes up, it rotates on itself, the pubourethral ligament is not able to squeeze the urethra completely, and urine leaks out. Now, this is called as stress urinary incontinence. Besides this, the muscles also become lax over a period of time, either if they are not being trained or they have not been exercised, or because of the effects of various hormones and the childbirth. So these muscles are also not able to support the continence mechanism, and that is why the women start leaking urine. Now, this is very common. Unfortunately, the statistics do show that more than 30% women have got urinary incontinence in their lifetimes, and it is proven that pregnancy and childbirth are the biggest risk factors for causing incontinence.
Very well narrated. Just to summarize, from a 2 centimeters vagina, a 10 centimeter head comes out, and when it comes out, it tears through all the pelvic supports, which are levator and muscles. So for this, is surgery only treatment, or do you offer any other treatments?
It depends. It depends upon the degree of incontinence. If you would have been asking this question to me in year 2014, surgery was the only treatment. And my journey into cosmetic gynecology also, as I mentioned earlier, started from my surgical treatments of incontinence. But after 2015 onwards, there have been a lot of energy-based devices which came into, and over a period of time, they have matured, they have improved. New devices, new technologies have come. So surgery still remains an option, and probably the only available treatment if there are severe degrees of stress urinary incontinence. But if the patient has got mild to moderate SUI and she does not want to undergo a surgery, which these days most of the patients do not want to undergo a surgery, then we have non-surgical modalities available, and incontinence can be very effectively dealt if you use the right technology in the right manner on a correctly selected patient, so she does not need surgery at all.
Thank you, sir. Now, moving on to the perimenopausal women. A lot of women do experience either laxity or difficulty during intercourse or dryness in the vagina, but they think it's normal. They must share in the groups of friends, but don't know that they can seek help. What options of treatment have you got available for them?
A very important question, and I think it affects every woman in their lifetimes. With pregnancy, with childbirth, and with menopause, there is vaginal laxity. And the vaginal laxity is the first sign of a woman who will later develop prolapse. And prolapse is a symptomatic issue. We will not talk about that at this time because we're talking about the vaginal laxity. Now, how does this vaginal laxity affect a woman? It decreases her self-confidence during her intimate moments, and she feels that she is not able to feel anything. She starts losing the interest and enjoyment of a sexual encounter with her partner, and a vaginal laxity actually starts making her disinterested in intimate acts. And so it also affects her partner because he also would not be getting any pleasure at that point of time, and both of them will start getting disinterested in the physical encounters. Now, that is one thing. So with these patients, although a surgical vaginal tightening or a surgical vaginal rejuvenation is one of the options available, but majority of the women do not want to undergo surgery just for this lifestyle issue. In the current medical practice, we have got excellent options today to manage these problems with a non-surgical way. You have to remember only two things: that anything which you use should not have a potential to harm a patient. Like if you use an ablative laser in the vagina, it can damage a patient by making fibrosis. It can cause fibrosis in the vagina. Like any carbon dioxide laser, if you use in vagina, it is ablative and it has a potential to cause fibrosis and harm the patient. Similarly, if you use any of these so-called these days the diode lasers, which have become very popular at some times because of them being cheaply available from the Chinese market. But do not forget that these lasers are meant for proctology. Their main chromophore is hemoglobin, and the laser, when it enters the rectum, it treats hemorrhoid by burning the blood vessels. The same thing it will do in vagina. It is not going to do something else in vagina and something else in the rectum. So the proctology lasers are similarly harmful and have a potential to decrease the blood supply of vagina, which is in colloquial terms just like burning the vagina. So these ablative lasers and these proctology lasers are absolutely harmful and must be avoided. Now, what is safe? A smooth RBMIAG laser is safe, the radiofrequency devices are safe, and the jet plasma treatments are absolutely safe. Even when we divide them between the heat-based and the non-heat-based treatments. So we have heat-based treatments, which can be a smooth RBMIAG laser and the radiofrequency treatments, which are safe. And on the other hand, we have non-heat-based treatments, which are working at a cellular and a biological level, the jet plasma treatments, which are the safest of the safe. So if we have to think about safety, I would say that if we can avoid heat in vagina, that is the best option. Now, coming on to efficacy. The evidence is there to prove today that if you treat the patient with non-heat based treatments using reversible electroporation, it treats vaginal laxity as well as urinary incontinence without any harmful effects, which is proven by a study which was published in the Swiss Journal of Medicine around almost 4 years back, that 25 patients underwent histopathology pre and post treatment, and not a single iota of damage was caused to any tissue there in the vagina. So proving it to be not only safe but also efficacious, and with a 12 months follow-up, the treatments had a good efficacy even at a 12 months follow-up. So I would say this is the treatment. To add to it, this takes care of the vagina, I would say. But the vagina on all sides is also covered by muscles. So it is extremely important to also take care of the muscles. And if you can manage a combination treatment using a energy-based device in the vagina and a magnetotherapy, so that can give amazing results. If we're talking of magnetotherapy, one thing I would love to mention is that when you use a magnetotherapy, if you have an option to use a magnetotherapy device which can create a magnetic field not only beneath the bumps but also behind the lower back, you should prefer to go for that, because that is going to give a complete treatment to the patient, taking care of the lower back muscles, taking care of the pelvic muscles, and the complete area in toto. So if you give these combination treatments using a good energy based device, preferably non-heat based, and a magnetotherapy device, preferably with a magnetic field not only beneath the bumps but also behind the lower back, I think you can have the finest and the safest treatment.
It's such a delight and relief to know that there are treatments available. One is energy-based, low-heat-based, which is radiofrequency, Nd:YAG, or jet plasma therapy, complemented with electromagnetic stimulation. This is so much of relief for so many women who are going through silently. These treatments, you absolutely clarified they're safe and how effective they are. What's the downtime? What's the recovery time? Do they need to take time off? Do they need hospital admissions?
Absolutely no. There's plain lunchtime procedures. So if you are doing any treatment which is safe, please understand that I clarified what are unsafe treatments and they're totally out of the bucket. So if you are doing all these treatments which are totally safe, they do not have any downtime, no downtime. Like, patient can resume her sexual activity just going home from the clinic and she can start her sexual activity. So absolutely zero downtime in these treatments and no admissions. They are just kind of walk in and walk out treatments. Admissions are not required at all. So they're very simple, and a woman can maintain complete privacy, because these are intimate treatments and a woman does not want to blow a trumpet that, I'm getting my vagina tightened or I'm getting my incontinence managed or something of that sort. So she can come in complete privacy and just walk out after getting a treatment done.
This is so absolute relief to women, and I feel every woman who has this problem should take these options. And because there's no knowledge, now women get knowledge that these are available. This is the treatment part. For the symptoms to not come back again, do you have any advice for these women about any exercises or lifestyle changes to make this more sustainable?
If a patient has got treated with non-surgical treatments, one thing which we must tell the patient is that since the aging and the damage to the pelvic floor is a continuous process and we have just reversed it by giving the treatments, the damage will continue. So she must come back for some kind of a review and, if required, a touch-up treatments after a year of her initial therapy. But at the same time, if she can keep practicing yoga, she can do Kegels exercises, and she can avoid any such thing which keeps increased her intra-abdominal pressure like chronic cough or constipation. So she can definitely have much better and improved outcomes. One more thing is important, that if the patient has a planned vaginal delivery, then these treatments must be postponed till the time she finishes her childbearing, because a vaginal delivery is again going to create the damage to the pelvic floor, and everything what you would have done will just get reversed.
Absolutely amazing. So maintain weight. If there's any cough or constipation, treat that and continue yoga and pelvic floor Kegels exercises. Thank you so much. And probably the final statement to all those women who are silently suffering, what is one message you would like to give?
Let me concisely tell you the background of the message, what I'm going to give. And let me first say the message. Chuppi todo, stritva se nata jodo. It means break your silence and connect back with your femininity. So what we did, we started an initiative when I was at AIMS. We started an initiative called Istri Vardhan Initiative, which we today carry further with the Elisante group. So we have this Istri Vardhan Initiative in which we provide absolutely free healthcare to patients who need it and who possibly cannot afford it. So we try to provide them absolutely free of cost healthcare. Now, the logo or the tagline of the Istri Vardhan initiative is Chuppi Todo and Istritv se Nata Jodo. Because women have been suffering in silence with these intimate healthcare issues for years and years together, because they feel embarrassed to talk about it. And even when they talk, there is evidence to it. This is a published data. If women have gone to seek treatment for incontinence, 50% of them have totally been frustrated with the advices given and they have not been benefited. So further they stop talking about it and they keep suffering in silence. So if they break the silence, there is a solution available. You must find out that if in your close vicinity there is a trained reconstructive and cosmetic gynecologist who is well trained in all modalities of these treatments and has got the right infrastructure to give you the solutions to your intimate healthcare problems, you must go to them. You must talk about your problems. You must voice your issues. And trust me, today there are enough trained doctors in India who can provide you state-of-the-art solutions without even a single incision, without a knife, without a surgery, and in an absolutely safe and efficacious manner. So just break the silence and let your problems just be washed away by someone you can trust.
I keep seeing women more often who had laser treatment elsewhere, and they're coming to me. So why did they go for the laser treatment? Because of this laxity and all. So they went with one problem and they come back with two problems, which are recurring vaginal infections, and they're finding it more hard to have intercourse and they say it's more painful. So what's your take on this? What about laser, and what should they have been offered instead of laser?
Do you know what laser was it?
Diode?
You said it. So, I mentioned that if you're going to use a diode laser, please understand, diode lasers are not bad. They're good, but they're good for proctology, right? So diode lasers have different wavelengths, and I also have got to know about this. We also get patients like this who have been treated at some places with a 1470 nanometer diode, and many of them even had a local anesthetic put before the laser applications. And the first thing is, the patients must ask their doctors that what laser you're going to use or what device you're going to use. Just telling that it is a FDA approved or a CE approved does not mean anything, because maybe FDA approved for doing a hemorrhoid treatment, but is it FDA approved for safety in vagina? That is the first question. Is it CE approved? Because these days the CE MDR approval is the most stringent condition of approval of medical devices in the world, much more stringent, and I would say much more honest than any other certification, including the US FDA. So the first thing is, you must check that is your laser or your energy based device or your technology which you are using, is it a CE MDR, medical device regulatory approved or not? That is the first thing. Secondly, is it approved for gynecology or not? CE MDR should be for gynecology, not for proctology. So that is something which is important. Now please understand that if you are using a laser for proctology, and proctology means you're using it for hemorrhoids, treatment of hemorrhoids or treatment of varicose veins, and if you insert that laser in rectum, it just burns those hemorrhoids, which are the varicose veins of rectal, which is the varicosities of the rectal veins. It is burning those veins and obliterating the blood supply. That is how it treats the hemorrhoids. Now, if the same laser you're going to put in vagina, do you think it's going to behave differently? Finally, the chromophore would remain the same. And for the laser of the same wavelength, like let's talk about the smooth Herbig laser. The chromophore is water. So the chromophore is water wherever you use it on the body. So similarly, a proctology laser, the main chromophore remains hemoglobin. Every laser can have minor chromophores, which are the other chromophores. But we talk about the main chromophore. The main chromophore for a smooth Herbig laser is water. The main chromophore for a 1470 nanometers diode is hemoglobin. So it is very simple. If the blood supply to vagina will not remain what it was, because 100% blood supply will not go in one or two treatments, it will take multiple treatments. And actually, she was a gynecologist who got treated with this particular laser somewhere. And she reached out to me after almost 4 months. And you will be surprised. She told me that before this treatment, she always used to get orgasms. After this treatment, she never got an orgasm. She never had an infection in her vagina before this treatment. And after this treatment, she has started getting vaginal infections. And she started feeling dryness and itching. That was the first time when I became, conscious that there is a laser like this available in the market today, which has a potential to harm. So our first hypothesis, I would say the underlying principle of medical practice is primum non nocere, so that you first do no harm. First principle is do no harm, and second principle is efficacy. That is how I put it.
Absolutely clarified. Thank you so much for clarifying. Every woman who is seeking treatment and getting a laser treatment done should check what kind of laser it is. A diode laser is a big no. A smooth erbium YAG laser is a yes. So women, when you're going for a treatment, please check what device is being used in your vagina and if it's going to give troubles or treat the problem you originally went with. So there's a very interesting phone call I got from one of the patients from Anantapur. So actually I should appreciate the doctor who treated her as well as advised her. So she has been given a diode laser treatment thinking it would help. And the doctor honestly came out to this patient and said, this is not the right treatment for you. You need different treatment and this is what you need. So in such cases, honestly, I appreciate the doctor who committed that it was wrong. But when this lady comes for vaginal laxity in the postmenopausal age group, what treatment would you offer to her?
She has already been given the diode laser?
Yeah, she has already been given the
and
diode laser.
Is there some problem which is facing?
She's facing dryness and she didn't have the laxity. Basically, the reason she wanted was the improvement of laxity. The outcome wasn't achieved.
I think, this patient now, once she comes, she needs a complete treatment. So there are two things which needs to be covered now. To try to undo the damage which has been done, and of course try to give her the maximum benefit what her original expectation was. So these are two things. What you can do is you can give her now a jet plasma treatment, probably maybe 6, or you may add even 2 sessions because she will need extensive treatment. And along with that, I would say here that you can use PRP. And if you have access, as I know you have access to this autologous exosomes by the Metacell technology, so you can convert the PRP into autologous exosomes and put these autologous exosomes also along while giving the treatment. Now the most interesting thing is that when you give the jet plasma treatments with the plasmaporation, you can just apply the PRP and exosomes without giving needles. Please remember, although people have tried to give PRP and exosomes with the laser also, but you should never give it, because the exosomes and PRP, both of them are supposed to be maintained at a low temperature. And if you give a laser or a RF, there is a heat and it is going to totally neutralize the effect of PRP or exosomes. So with the plasmaporation, because there is no heat and the pores are open, the nanopores are open at that point of time by reversible electroporation. So if you apply the exosomes, the autologous exosomes I'm talking of, created from her own blood, with the Metacell technology, you can apply it right with the plasmaporation, and that is what is going to correctly rejuvenate her vagina. Hopefully, keeping the fingers crossed, she may have the requisite results what she wants. But yes, you must tell her that you cannot guarantee that the damage which has been done to her, it will reverse or not, because that will totally depend upon her own body, how it responds to the treatment now. So that is why I always say it is very important, first do no harm. I have been practicing this now, I have been using these energy-based devices for more than a decade. I was the first person to start using these energy-based devices way back in 2015 when they were launched. I have never ever put an ablative laser in the vagina, only for this reason. Even 10 years back when the choices were very limited, I decided I will never put an ablative laser into vagina because this can cause fibrosis and harm the patient. Similarly, the day I did a deep dive, when these diode lasers started coming into gynecology, and I did a deep dive into the technology and how the proctology laser can do a role reversal, that it can do something else in rectum, and someone is thinking that it is going to do a role reversal in vagina. On one side it's burning vessels, on other side it will create new vessels. So when I realized that that is not the scenario, so I have totally avoided use of even these kind of machines, that let us not harm the patient. So we use all good technologies. Please put PRP or autologous exosomes into her body so that it totally, I would say, restores its normal anatomy.
Thank you so much, sir. So what inspired you, your journey into cosmetic gynecology to start with?
Thank you for having me here, Dr. Narmada. And cosmetic gynecology, when you talk about that, what inspired me to start this journey, it was my patients. It is more than almost 1.5 decades back. I used to do a lot of incontinence surgeries. And at that point of time, I was working with the Indian Armed Forces, wearing uniform and being a gynecologist to the wives and mothers and daughters of our soldiers who were serving the country. I was posted in the Northeast at one of the Air Force hospitals, and people would come to me from all over the Northeast and beyond, the entitled patients, to get treated for incontinence. And that was something, which I was doing day in and day out. So those times, I still remember that there was a lady who came to me for her incontinence issues, wife of a serving soldier. And this lady had served as an air hostess earlier, and she happened to belong to Meghalaya. And while I was examining her, she asked me that besides this, I also feel loose and lax when we are together with my husband, and during intercourse, I don't feel anything. Can you please do vaginal rejuvenation? Now, I honestly told her that, look here, I'm not trained into it and I don't do it. And I knew that something of this sort was at that point of time happening in the West. And it had just started a few years back, and it was building up, and I was reading about it. Then she said me that, okay, if you don't know it, refer me to someone who can do it. I said, I don't know anyone in India who can do it for you. She says, then you have to do it. And that is where, it inspired me that I will have to learn it to serve the patients in a holistic manner and a better manner, because women do need it. And I have always believed that whatever women want as their healthcare provider, I must be able to provide them. That is when I found out that how can I learn it, how can I do it, and it started my journey into cosmetic gynecology. And from there on, there was no looking back. I traveled all over the world almost to learn the art and later teach the art. And it was, in one word, if I say that what inspired me, it was the women, my patients, to whom I'm dedicated to serve.
Absolutely amazing story. I'm sure it must have been challenging. Was it difficult to make it legitimate medical need rather than the word cosmetic and focus on the cosmesis?
When we started doing cosmetic gynecology and it started becoming popular, we hosted the first World Congress of Reconstructive and Cosmetic Gynecology in 2017, a congress which we prepared for 2 years, where we had speakers and delegates coming to India from almost more than 36 countries, and it became a big roaring success. At that point of time, one of the vice presidents of the Royal College of Obstetricians and Gynecologists also attended it. He had come to see that what is happening, and they were so delighted to see it that they said that let us do a conference with RCOG. A Recogyne Commonwealth meeting was what was decided. Now, everything was signed. I flew to London, went to the RCOG office. We made an organizing committee, signed the documents, and even the dates were announced, and marketing was started for that globally. We started engaging top-of-the-line speakers for that. But suddenly, 3 months into it, one day I get an email from the Royal College that some of their fellows have objected that why the Royal College is hosting such a meeting And cosmetic gynecology is something which is not taught anywhere. It's not a recognized medical subspecialty. And few people had an objection even that it is just like the female genital mutilation. Because at that time, there was a lot of criticism which had started happening in the United States of terms like designer vaginas and Barbie labias, which definitely are derogatory and disrespectful to women. So the Royal College officers wrote to me, although I tried to reason out with them that you are trying to decimate the science without giving it a chance to represent itself. But the Royal College, being the Royal College with the stiff upper lip, they said that we are helpless, but that is what it is and we will not be able to continue with it. That is the day I decided that this needs to be a legitimate medical science, otherwise these things will keep cropping up time and again. And as the God was with us, I think an opportunity came. I had taken a premature retirement from the armed forces because I wanted to totally dedicate myself to reconstructive and cosmetic gynecology. And the government of India got to know about my skill set. I was asked to start a department of reconstructive and cosmetic gynecology at AIIMS at its Rishikesh campus, and with a mandate to start a MCH program in cosmetic gynecology. The director at that point of time, I must mention his name, Professor Ravikant, was a great visionary who reposed full trust in me at that time and gave me an absolute free hand to establish the department. We created a complete 3 years curriculum, got it approved from the Academic Council of AIIMS, and then a MCH in cosmetic gynecology was started in year 2019. Now the next task was to make it legitimate all over the country, because till that time it was legitimate at AIIMS where we were running this MCH program, but then the regulatory body in India is the National Medical Commission. So we further started submitting our documents, papers and everything to NMC, and the NMC recognized the MCH program in cosmetic gynecology in year 2020, making it a legitimate medical science. If I tell you the inside story, the journey was at times very lonely. This journey was at times being mocked at by people, laughed by people, and definitely, there were some people who never wanted that if they are not doing it, why should someone else do it? So we had the roadblocks, a lot of roadblocks, but since the intentions were pure and it were just to establish a new subspecialty which can not only help women but also help a generation of gynecologists to establish their careers in this new subspecialty and provide, I would say, modern day healthcare to modern day women. So the God was, I think, very, very kind, and it was only because of all the efforts which everyone put in at that point of time that it became a legitimate medical specialty. Now for last 6+ years, we're sitting in 2026, from last 6+ years, it's a legitimate medical science.
What an amazing journey. Everybody sees somebody when they're successful, but this is how the hardship is to come to that stage. Commendable achievement. So to summarize, if somebody had a diode laser in the vagina,